G'day, my name's Tanner McMillan and I'm 16 years old.
Hey, I'm Stace and I'm 40 years old.
Hi, I'm Tanya and I'm 43 years old.
I was bitten at the age of 11 in eastern Victoria, East Gippsland, in the Cahoon Forest at Lakes Entrance.
I was bitten in Hawaii in January in 2018.
I was bitten in the woods in New Hampshire, USA in 2005.
It took me about 12 months to get diagnosed, and I was definitely one of the luckiest ones to get diagnosed that quick, as that's pretty unheard of.
It took 12 months for me to get diagnosed.
I was diagnosed 14 years after my tick bite.
I would have seen over 10 doctors before actually getting diagnosed, as well as going into hospitals and getting pretty spun around there too.
I saw 10 to 15 doctors prior to being diagnosed, including neurologists, rheumatologists, GPs, special internists. I was seen at the ER multiple times and also hospitalised multiple times, and then eventually found a doctor who was able to help.
I saw around 10 doctors prior to getting diagnosed, including GPs and neurologists.
What is my biggest symptom? My biggest symptom when I was sick was a lot of different things. Definitely joint pain and all that sort of stuff. But something that's stayed with me now through my remission is 100% chronic fatigue. Chronic fatigue is like my biggest battle at the moment. It comes and goes, and I have to really closely manage it, as I do a fair bit of sport and it can really get me back at the same time. So chronic fatigue is definitely the biggest thing I struggle with, but back when I was sick was probably joint pain, nerve pain and all that sort of stuff. But chronic fatigue still takes a toll on me today, even years after having my diagnosis.
Some of my main symptoms are fatigue and pain, widespread pain, neurological symptoms including brain fog, light and sound and chemical sensitivities, chest pain and other heart-related symptoms, and all up about 85 ongoing day-to-day symptoms.
There isn't a part of my body that hasn't been affected by Lyme. My legs are a mess. I have posterior tibial tendon dysfunction and bilateral foot drop in both legs. I have issues with my heart. I've been diagnosed with postural orthostatic tachycardia syndrome, which means that I can't even stand up without my heart rate going through the roof. I have issues with my bladder requiring regular treatment, and the fatigue is absolutely extreme. As well as that, I've probably got around 40 other regular symptoms as well.
My biggest challenge with Lyme, some people would think, is having Lyme's disease, but my biggest challenge and hurdle to get over was definitely being accepted and diagnosed in the medical world.
The biggest challenges that I've faced with Lyme has been trying to continue to work and manage finances and also maintain relationships.
My biggest challenge has been acceptance in the medical field. I was told so many times that because I was a young, high-achieving female, I just had anxiety, depression or stress. That meant my symptoms were missed for so many years. Even now I have a diagnosis of Lyme, it's still not accepted in the medical field. So that's been my biggest challenge.
Lyme's disease affected my life day to day in so many ways, whether it's not being able to go kick the footy on the footy field, not being able to compete in a surf club event, or even just getting to school and socialising and being able to tell my friends what was wrong with me. It was 100% one of my biggest struggles was education, and I'm still catching up on that now.
How has Lyme changed my life day to day? Well, I'm not the person that I used to be. I have to rely on family and friends to do everyday tasks. I'm not independent like I used to be, and my life revolves around my treatment schedule. I'm not the active person that I used to be. It's very frustrating.
My life is totally different now than it was before. I can't drive. I'm not allowed to leave the house unaccompanied. I can no longer do basic household tasks like the laundry or emptying the dishwasher. Some days the best I can do is get out of bed and have a shower. So many days I'm just bedridden. So for someone who previously was extremely active and on my feet 18 plus hours a day, that has been a major shift.
The financial impacts of my illness is kind of on my parents' behalf, as I'm, quite young. I don't have to worry about that stuff, luckily, but as most people know, nothing's covered, because it's not accepted in Australia. So everything was out of pocket.
The financial implications of Lyme have been devastating. I've had to use all of my savings. I've also lost potential earnings going from full-time to part-time, and had to use all of my annual leave, long service leave and sick leave. The monthly cost of treatment plus mortgage and life bills, and it leaves nothing left over, so you don't really have any quality of life financially. The cost of treatment can be tens of thousands of dollars a year that you didn't previously have, so it's not like it's something that you've budgeted for.
Pre-diagnosis, I was probably one of the most prepared people you could find financially. I had mortgage insurance, income protection insurance, private health insurance. I had years worth of savings. None of that helps when you get an illness that is not recognised in Australia, because those funds and insurances don't pay out for those illnesses. Being sick with an illness that is not recognised has absolutely devastated me financially, to the point where I'm struggling just to get by.
There is a lot of things that need to be changed on the stance of Lyme disease in Australia, but definitely one of the biggest ones is being accepted and acknowledged. That puts so many Lyme patients through stresses, whether that's getting treatment or, financially, as just talked about, nothing's covered. That's also knowledge. People need to be educated that Lyme disease is a risk, that people in Victoria and Australia are at risk of Lyme disease, rather than not knowing about it and maybe even facing misdiagnosis, as well as just knowing there's people actually there for them, which is the biggest thing. And that was 100% the biggest issue in my story, was that I didn't know what was wrong with me, others didn't know what was wrong with me, and then that second guess is on yourself. So yeah, 100% by far is acknowledgement, and people really need to be supported in Australia, and what's happening at the moment is not on. And that's half the reason, as most of you will probably know, that I'm doing a walk for Lyme disease called along the 90-mile beach, in hoping just to raise awareness and funds for that sort of stuff. So that's 100% the biggest radar on my beacon, yeah.
In Australia, we definitely need some changes. We need government and medical recognition. We need better testing, and we need access to treatment. There needs to be medical or scientific studies so that we can have treatment that is reliable and available for our patients.
There are so many changes that need to be made regarding Lyme in Australia. We need to be able to be diagnosed. We need to be able to be treated. We need education for doctors. We need research to happen. basically the whole system regarding Lyme needs change.
If you could say anything to the AMA, what would you say? It's a really good question, because I'd say a lot of things and I'm sure they'd get sick of me in doing so. But I would say accept. We need acknowledgement. We need education. We just need to change. The way people are treated and disregarded in this system is just horrible. It actually makes me feel quite sick that what I went through is getting lived through by so many other people. I'd say to them in nice terms, change, so others don't have to be put through what they put through now. It's just not fair. With a leading system that we have at the moment, why is it like this? It shouldn't be like this. Change, do better.
If I could say anything to the Australian Medical Association, it would be that it's time to move forward and do better by our patients. We need to provide doctor training. We need to allow access to affordable care. We just need to do better for our patients. We're suffering and you're allowing that. It's not good enough.
To the Australian Medical Association, I would say these diseases are real. People are suffering and you're allowing that to happen. I can assure you the thousands of people across Australia who have tested positive to Lyme disease have not gathered together to create a disease for any kind of financial gain or attention, because I can assure you when you get a disease that isn't recognised in Australia, there is no financial gain or attention to be held. This is real. Imagine if we told cancer patients they couldn't be diagnosed or treated in this country. There would be outrage everywhere. That's exactly what's happening to Lyme disease. Pretending it doesn't exist and hoping it'll go away isn't working. People are getting sicker, people are suffering, and it is your job to help us and create that change so we can actually be treated like humans in our medical system.